Many men don't know, or prefer to ignore, a fundamental truth. The penis also ages. Just like the heart, brain, or bones, this part of the body is also subject to structural, functional, and emotional changes as we age. And when we don't take care of it, the consequences aren't just physical. They can affect our self-confidence, dignity, and sense of connection with our bodies. Neglecting this aspect not only compromises sexual function, but can also affect a man's dignity, self-esteem, and self-perception. Yet no one talks about it, or they do it too late, when complications have already appeared that could have been easily avoided. My name is Dr. Whitman. I am a urologist, and for over 30 years, I have been helping mature men not to lose what really matters: vitality, intimacy, and male identity. It is not just about maintaining good erections. It is about still feeling alive, capable, connected. That's why today, I want to guide you on a simple but essential path. I'll tell you about 5 fundamental measures for the health of your penis, especially valid after the age of 60. They are effective, safe strategies based on clinical experience and designed to concretely improve the quality of your life. They are not miracle cures or pharmacy solutions. They are daily choices that can change everything. And before we begin, I ask you for a small gesture. Write a short, personal phrase in the comments that represents your commitment to taking care of your body from now on. A motivating statement like, "I respect my body." Do it for yourself. And if you like the video, subscribe to the channel, and activate the bell. You will receive content designed specifically for your age and your well-being. Let's start with the first tip, and it is perhaps the most underrated of all. Keep your penis active. Although it may seem strange, it is true. Using it is the best form of prevention. Many men, after 60, accept with resignation the idea that their sexual life is over. It's normal. It's age, they tell themselves, and they stop stimulating themselves, seeking pleasure, living their sexuality. But it is precisely this inactivity that causes the worst damage. The penis, like any other part of the body, needs stimulation to stay healthy. When neglected for weeks, months, years, blood flow slows, elasticity is lost, tissues stiffen and atrophy. This is not an urban legend. It is pure physiology. This condition is called disuse atrophy, and the truth is, it can affect anyone at any age, but it's especially common in older men who have stopped all sexual activity. But the good news is that it can be prevented, and often it can be reversed. How? Just maintain a minimum of sexual activity. Not necessarily with a partner. Even autoeroticism, done regularly and without haste, keeps the circulation active and preserves the functionality of the erectile tissue. It is not a whim or a whim. It is an integral part of man's health. And for those who find it difficult to have or maintain an erection, there are useful and approved tools: vacuum pumps, pelvic floor exercises, manual stimulation. The important thing is not to stay still. I have seen dozens of men, even over 80, who have found energy and motivation just by reactivating this aspect of their lives. And do you know what often happens? That when a man rediscovers sexual pleasure, he also rediscovers the pleasure of living. He begins to take care of his diet, to move more, to smile. It is a powerful domino effect. There is another aspect that should not be underestimated. Many men connect their virility to their sense of identity. Feeling no longer capable leads them to a sense of loss, as if an important part of their masculinity has vanished. But sexuality is not just a physical matter, it is connection, it is presence, it is pride. There is no need to go back to the performances of 25 years. It is necessary to still feel part of your life. It is necessary to never stop having a body to honor and live. So if you haven't been sexually stimulated for a while, start today, even a little, but regularly. Don't think it's too late. It never is. Your body has an amazing memory, and if you treat it with respect, it will surprise you with its responses. And once you regain confidence in yourself, you will notice that confidence is reborn. Intimacy, motivation, and the pleasure of living are all linked. It all starts with a small gesture. Don't stop being active. But if activity is essential, there is another aspect that many men neglect, one that has to do with something we believe we do well, but often do not do at all as we should: intimate hygiene. Talking about hygiene may seem trivial. We all think we know how to wash ourselves. But in my clinical experience, I can tell you that most adult men have never really learned how to properly care for their penis, especially if they are uncircumcised. And with age, this mistake can have serious consequences. Male intimate hygiene, especially after the age of 60, is not just a matter of cleanliness. It is a matter of prevention, respect for one's body, and also dignity. As time passes, the skin becomes more delicate, the immune system slows down, and the warm and humid environment under the foreskin can become an ideal breeding ground for infections, inflammation, and bad odors. Many men come to my office with irritation, redness, bacterial or fungal infections. Some think they have contracted a sexually transmitted disease, but in reality, it is simply chronic poor hygiene. And in severe cases, it can even lead to precancerous lesions or chronic balanitis. Especially if you are not circumcised, it is essential to retract the foreskin completely every day. Wash with warm water and a neutral detergent, never perfumed or aggressive, and then dry carefully. Residual moisture is one of the most dangerous factors. Bacteria love humid and warm environments. After any sexual activity, even if light or solitary, it is recommended to clean the area again. Vaginal fluid, lubricants, or even just sweat can alter the pH and cause bacterial growth. This does not take more than a minute, but it can save you days of discomfort, redness, and doctor visits. Yet, the real benefit goes beyond the physical. Taking care of your penis every day, like you take care of your teeth or your face, improves your relationship with yourself. Many men tell me that since they have included this simple habit in their routine, they feel more organized, more in control, more attentive to other aspects of their body and health. It's a matter of mindset, of habit, and also of inner message. When you take the time to groom yourself carefully, you are telling your brain, I am worthy. I deserve respect. I take care of myself. And it is exactly this kind of attitude that protects a man from feeling old, neglected, or invisible. But there is another mistake that is much more common and dangerous than you might think, and it is one that occurs during intercourse, especially when you act in a hurry or with pressure, having sexual intercourse without a complete erection. I know it may seem like a minor detail, but it is not at all. Many men, caught up in the moment or eager not to miss the opportunity, try to have intercourse even when the erection is not yet stable or full. And unfortunately, This can cause internal damage that accumulates over time. The penis, when not fully erect, does not have the rigidity necessary to withstand the friction or pressure of penetration. This causes internal microtraumas, imperceptible at first, but which over time can cause scar tissue to form under the skin. This leads, in many cases, to the so-called Peyronie's disease, a condition in which the penis curves in an abnormal and painful way, sometimes preventing sexual activity altogether. And no, it is not rare. I see it more and more often in my patients. The cause? Almost always. Penetration, with partial erections or exaggerated thrusting, without adequate lubrication. And do you know what the saddest part is? Many men live with this condition in silence, out of shame or ignorance. They think it is the fault of age, when in reality it could have been prevented with a little attention. That's why I firmly urge you not to rush. Give yourself the right amount of time. Wait until your body is ready. If you're using erection medications, don't rush them. Let them take effect. If you need more stimulation, take it. And above all, always use an adequate lubricant, especially after the age of 60, when natural lubrication can decrease. Communication is also key. You don't have to prove anything to anyone. Talk to your partner. Explain that you want to take care of your body, that it's not about performance, but about well-being. A conscious relationship is deeper, more enjoyable, and infinitely safer. It's not a sign of weakness to slow down. It's a sign of respect for you and those around you. And now, we come to a topic that for many is still a taboo: pornography. But if you are willing to approach this part with maturity, you may discover that behind a seemingly innocent habit lies a major obstacle to your sexual well-being. We live in a world where access to adult content has become instant, free, and unlimited. All it takes is one click. And for many men over 60, especially those who live alone, have lost a partner or feel disconnected from real intimacy, pornography can seem like a refuge, an easy way to stay connected to their sexuality. But I want to speak to you honestly, man to man, doctor to patient. Pornography abuse is one of the main obstacles to sexual health in mature men today. And often those involved don't even realize it. At first it seems like a harmless solution, a way to relax, to feel desirous again. But over time, the brain gets used to artificial, rapid, intense visual stimuli. Stimuli that do not exist in real life. This process is called desensitization. The brain, accustomed to receiving a certain type of input, stops responding to the natural stimulus. And then it happens that when you finally find yourself next to a real person, the body no longer responds. The erection is weak, the pleasure is distant, the desire dies. Not because there is no attraction, but because the brain is no longer able to associate real stimulation with pleasure. It is as if an invisible thread has broken. In my office, I have met men who, while still feeling alive and desirous, come to confess with frustration, "Doctor, when I watch a video, everything is fine. But with my partner, I don't feel anything anymore." And it is heartbreaking to see how this silently slides into a sense of guilt, shame, emotional impotence, as well as physical. It's not just about the erection. It's about connection. It's about presence. It's about confidence. In addition, chronic and solitary consumption of pornography often leads to emotional isolation. You become spectators of sexuality, no longer protagonists. And this generates anxiety, a sense of inadequacy, and distance from others. I'm not saying you have to eliminate it completely, but if you feel like you use it regularly, that you always need that little something extra to stimulate yourself, then maybe it's time to put real intimacy back at the center. Not the perfect kind in the movies, but the kind made of real bodies, imperfections, shared breathing. You can start by reducing your consumption, choosing to stimulate yourself without screens, using your imagination, memories, fantasy. And if you have a partner, try to slow down, talk, dedicate more time to foreplay. Emotional closeness has an enormous power over physical desire, even at 60, even at 70. Desire doesn't end with age. It changes shape, yes, but it continues to exist. It just needs other paths, slower, truer, deeper. Limiting pornography doesn't mean giving up pleasure. It means rediscovering it. And now, I want to talk to you about a topic that ties together everything you've read so far, your lifestyle. Because the truth is simple and powerful. The way you live every day directly impacts your sexual health. I know the temptation to look for a magic pill is strong. It is understandable. But in tens of thousands of consultations, I have learned that no medicine can really work if it is not supported by healthy habits. Your lifestyle is your first treatment, and it is the most powerful. Think about your heart. Erections depend on good blood flow. If you smoke, if you are sedentary, if you drink too much, if you eat junk food, your vessels narrow, they become stiff. And when the blood no longer reaches where it should, the erection becomes weak or disappears. Yet, every day is an opportunity to change. Just a 30-minute walk is enough to start reactivating your circulation. Just reduce smoking to make your arteries breathe better. Just replace alcohol with water to start rebalancing testosterone. And when you eat fruit, green leafy vegetables, oily fish, you are literally nourishing your manhood. All these improvements don't just affect your body, they affect your mind too. You sleep better, you think more clearly, you feel stronger. And sexual desire, often seen as something mysterious, comes back. I have seen men over 70 return to fully living their intimacy only thanks to a change in lifestyle. They were not superheroes. They were men who had understood that health does not come from the outside, but is built every day with simple and constant gestures. And then there is a beautiful moment, the one in which the man realizes that his body was not broken, but only neglected. That moment in which he regains confidence in himself, to feel capable, energetic, present. If you recognize yourself in all this, if you have felt that something is lost, but you are willing to find it, then know that it is not too late. Never. Now I'm going to give you one last surprising tip. Perhaps the simplest of all, but also the one that silently has the most effect. A nightly habit that can really protect your male well-being without you having to do anything except let go of an old garment. It may seem trivial, perhaps even funny, but one of the most neglected habits of men after a certain age, and one of the most important for genital well-being, concerns what we wear or don't wear at night. That's exactly what I'm talking about. Sleeping without underwear, or at least wearing something loose and breathable. Yes, it really is that simple. And yet, this small change can protect the health of your penis much more effectively than you might think. Why? Because at night, the male body enters a phase of natural repair, in which the so-called spontaneous nocturnal erections also occur. They are physiological, normal, healthy. They serve to keep the erectile tissues oxygenated, to preserve their elasticity, to keep the vascular structure in exercise. It is as if the body took care of its own well-being. But if during these erections you wear tight underwear, tight pajamas, or synthetic clothing that compresses the genital area, you may unknowingly hinder this natural process. The constant pressure, even if minimal, can disturb blood flow, cause micro-lesions, skin irritation, and, in the long term, even the accumulation of scar tissue. Never underestimate the impact of a detail like this. Your body works even when you sleep. Giving it the best conditions to do so is not a whim. It is respect. It is awareness. And this is where I want to take you to reflect for a moment on what these 5 tips, so different from each other, have in common. Because at first glance, they talk about sexuality, hygiene, erections, habits, but in reality, they talk about you, about your value, about your identity. Getting older doesn't mean ceasing to be a man. It doesn't mean giving up pleasure, intimacy, or dignity. It means adapting, yes. But it also means choosing every day to love yourself, to not let yourself go, to continue taking care of your body with the same respect with which you take care of your emotions, memories, relationships. Every gesture you make for your penis, and therefore for yourself, is a message you send to your mind. A message that says, I am here, I matter. I deserve attention. I have seen men transform even after years of giving up. Men who thought they were done with sexuality, who felt out of the game, surpassed, invisible. And then one day, they decided to start again, one step at a time. They started to get active again, to wash themselves better, to live intimate moments more slowly. They started to walk, to eat better, to sleep without constraints. And slowly but surely, they found themselves again. Not as they were at 30, but as they are today, mature, aware, still alive, still capable. If you've come this far, it means you want to take care of yourself too. And for that, I thank you. But it's not over. We have reached the end of this journey, and if you have followed me this far, I want to tell you something from the heart. You have just made a gesture of great value. You have dedicated time to yourself, to your health, to your dignity. And this, today more than ever, is an act of strength. What we have seen together are not just 5 medical tips. They are 5 lifestyle choices, 5 ways to tell your body and yourself that you deserve attention, respect, and well-being at any age. Because sexual health, in the adult man, is not a luxury. It is a fundamental part of the quality of life. You have learned how important it is to keep your penis active, even without a partner, because the body, like any instrument, needs to be used to stay in function. Disuse, atrophy, is not an irreversible sentence, but an invitation to restart what you thought was lost. You have understood the value of daily intimate hygiene, not only as a gesture of cleanliness, but as a ritual of care, as respect for a delicate and significant part of your body. Hygiene is prevention. It is self-esteem. It is attention. You have discovered how harmful forced intercourse with incomplete erections can be. That haste, pressure, pride can be costly, and that listening to your body, waiting for the right timing, using lube, and communicating with your partner are all signs of maturity, not weakness. You have looked honestly at your relationship with pornography. You have reflected on the fact that sometimes what seems harmless can distance us from reality, from true connection, from natural desire, and that limiting certain artificial stimuli means recovering authentic pleasure. You have accepted the simplest but most effective suggestion: sleep without tight clothing. Let your body truly rest. Let it regenerate. Breathe. Maintain its vitality even while you sleep. And finally, you have understood a great truth. The most powerful medicine is your lifestyle. It is not the pills. It is the choices you make every day. The food you put on the table, the steps you take, the water you drink, the time you dedicate to yourself. It doesn't take miracles. It takes consistency. It takes the will to take a small step today and then another tomorrow, and so on. Not to go back in time, but to honor the time you have ahead of you. Because you know what? Sexuality after 60 is not over. It's just different, mature, slower, deeper, freer from expectations. It's a new language, and it's up to you to learn to speak it. And even if no one has ever told you this clearly, I want to tell you now. You are not too old to desire. You are not out of time. You are not invisible. You are still a man, and you have a right to pleasure, to connection, to trust. That's why I invite you not to let these tips remain just words. Apply what you can, right away. No great revolutions are needed. A small gesture is enough. Today, try to do one of these things, and then another tomorrow, and observe what changes inside and out. Remember, there is nothing embarrassing about taking care of your sexual health. There is only awareness, respect, and courage. And if this content was useful to you, I ask you a small favor. Support our work. Like the video, subscribe to the channel, and activate the bell to receive other tips designed for men's health over 60. And if you want to support us directly, you can also leave a super thank you from the icon 8. This video, it's a way to tell us that what we do has value for you. I thank you, truly, for listening to me, for reflecting, for choosing to take care of yourself. Every man who decides not to give up on the idea that it's too late now is an example. And if you are here today, it means that you too are ready to write a new page in your life. You are not alone. There are many of us, and together we can build a new vision of male aging. A vision made of respect, vitality, dignity. See you soon, and remember, there is no age to choose to be well.